My name is Jane. I'm a clinical midwifery specialist working at Ryde Hospital, where there's a midwife-only birth centre. I've been a midwife for probably 34 years now, and I've had vast experience in looking after women in their antenatal time, in labour and after they have their babies. When a woman finds out that her baby is breech at term, they're usually disappointed, I find. They're looking forward to having a normal birth, and I think quite often their sort of wishes feel like they're a little bit dashed at that point, I think immediately straight away. I think also they get a bit worried when they realise their baby's breech, because they may well have heard that there's some problems about a baby being born breech. The women will often ask me about the safety of their baby being in a breech position, and they'll also will ask me, what do we do next? They want to know what will happen in the next few weeks of their pregnancy. And when they ask me that question about what's next, I usually try to reassure them. I say it's not an unusual situation. Coming at term, maybe 1 in 50 babies are in the breech position, maybe slightly less. So what happens next as well if the baby doesn't turn? I'll continue to see that woman and give her support. I'll organise for her to have an ultrasound scan which confirms which way the baby is lying. Usually we use our clinical expertise to work out which way the baby is lying, and then the scan will just confirm that is the case. And it is at this point that I will introduce them to the possibility that they might want to consider to have their baby turned into a cephalic position, which is called external cephalic version. This is done by a doctor. It's not a procedure that's performed by a midwife. So it's done by an experienced doctor and it's normally done in a hospital situation too, not in someone's home or in the clinic, and it's done in the safety of a hospital. When women are trying to decide whether to have an ECV or not, I think they need a lot of information about it. So I would talk to them in depth about how the procedure is successful and not successful, also why it's done, and also the whole procedure, what would happen on the day. And of course they'll want to know the success rate as well. Before and after ECV, it's important that the midwife makes sure that the baby has not been harmed in any way during the procedure. So we do a monitoring on the heartbeat for 30 minutes before the ECV and for 1 hour after the ECV. In the following day, the woman would then come back to the hospital or to her midwife to have another CTG, just to check that that baby is still okay. In the meantime, a woman can also ring if she's worried about any bleeding or any issues she may have with her baby's movements, or if she thinks her waters are broken, she must call straight away and speak to the hospital staff or her midwife. I think most women consider ECV as an option straight away. Some women may not know much about it and may be a bit fearful of the procedure, but with education and information and support, they usually choose to have ECV. Women often would ask me whether the ECV procedure was painful. They worried that it would hurt and whether it would hurt their baby. I honestly answer them with that from my knowledge and from when I've seen ECV, that it is an uncomfortable procedure. Their skin hurts a bit, and it would not be entirely without some discomfort. The procedure doesn't last a very long time, and I think most women can weigh up the their options when they're trying to work out whether to have some discomfort for a short amount of time, and the possibility of their baby being able to be turned to head first position. When a woman has an unsuccessful ECV, there's usually some disappointment. Immediately the midwife deals with the situation after the doctor has attempted the procedure and has left. We discuss options, I give them support, and I would see her again the next day to make sure her baby was in an okay condition, and we do usually check the baby again. So I'm contacting her again to see how she is managing her feelings around an unsuccessful ECV. My experience of ECV has generally been very positive. It's not always successful, especially in first-time mothers, but it's definitely a procedure that I would encourage women to use. As a midwife, I think it's an important thing for women to be able to be offered the procedure.